We've carried our Healthy Thursday conversation forward to today, Friday, because we couldn't quite finish our questions and answer segment with the AM doctor. So we've got our doctor back on call. Dr. Joseph Akama is head cardiology department, Korle Bu Teaching Hospital. He's been so kind to book a date with us again to consult with him. So all your questions, all the things you want to ask Dr. Akama, he's back with us. There's a message that I received from Napoleon Doche Walker. Napoleon says, greetings to the AM doctor, such a hardworking and kind doctor. Oh, we still have angels among us. Dr. Akama was one who took care of my dad at VRA Hospital in Akosombo. I thought I would just share this message. Dr. Akama, good morning to you.
Morning, Mama B. How are you?
I am very well, thank you. Are you operating? What's happening today?
Well, it's a message. I just want to shout out to all the healthcare workers who have been diagnosed with COVID-19 in line of duty. These people were taking care of patients and they got infected. It's a message to all the healthcare workers who are out there. Please protect yourself for your country, for yourself, for your family. Please take note. This is not a joke. COVID-19 is not a joke. To the public, I advise you to stay at home. Please stay at home. If you don't have anything doing outside, do not go out. If you go out, cover your nose. Having said that, I want to say good morning to everybody. I'm looking too serious, so let me relax a little bit.
And I also wanted to say this before you start, because I know you have a lot of questions that we forwarded to you. We haven't celebrated you enough, so I just want to say that we're proud of you. Thank you for all the good things that you continue to do.
Well, thank you very much for giving me the opportunity. We've always been trying to help and serve Mother Ghana. People say we sacrifice, but a lot of people, others, sacrifice more than what we have done. So we really applaud everybody.
All right, let's go straight into the questions that you have.
Yes, so I divided them into 3 bits. One was related to COVID-19, another one unrelated at all. Mama V, can you imagine somebody is asking about erection at this point? Anyway, that is life, isn't it?
Well, people are home, so if that's somebody's issue.
I guess. Anyway, and then there are some that are in between. People have chronic catarrh or having symptoms that have catarrh-like features. What should they do? So let me start with those that I think are related to COVID-19. One of the questions was the micro droplets. How does it go? How is it? And whether food vendors can spread the virus if they have it and they're not wearing masks. Also, how long does the virus stay in the air? So it is true that food vendors, if they have the virus, will spread the virus into the food when they're serving you, when they're talking to you. So if the food vendor is not wearing a mask, please alert the health authority, AMA, or whichever local authority you have, and then let them wear the mask, please, or avoid their food, because they can spread it, and when you buy the food, you are going to also get into trouble. Number 2, the droplets. This is a new virus. We still don't know a lot about it. A recent research showed that it can stay in the air for about 3 hours. In the micro droplets. What are micro droplets? These are things that come out that you can't see. You know, when you get close to somebody and he's talking to you, you can feel some saliva on your lips, your face. You can feel it. But there are some that you might not feel, and those are the micro droplets, and they get carried by the current. So if you're in a highly ventilated place, like in open air, then it can be carried away and it will drop off somewhere. But if you're in a poorly ventilated area, in a small room, then everybody's speaking, then micro droplets can stay in the room for long and you can inhale it, meaning it can go through your nose into your lungs. Or it can go through your mouth. So please, the president said, don't get crowded. Don't stay in crowded places. Don't even go out. In your home, stay away from each other when you're watching TV, please. Number 2, the food vendors have been advised to take precaution not to infect people. It can be contagious even if the person is not symptomatic. Yes. If the person is not symptomatic, this virus can be spread. So maybe 2-3 days before the person actually exhibits the symptoms, he'll be spreading it. And there are some people who have been noted to be super spreaders. Who are they? They spread the virus like nobody other. So when they come around, they spew out the viruses. Obviously, when the person begins to cough, begins to sneeze, then the spread is even worse. When they begin to have lung problems, the spread is worse. So the doctors and nurses who take care of these people are exposed to extreme danger. They're exposed to extreme danger. Anytime a patient coughs into a doctor's face or a nurse's face, that is serious, and the person can get infected. That's why the doctors and nurses need the PPEs to protect themselves. Now, let me also mention this about the erection. Is it directly related to COVID-19? I would say maybe. The men who want to stay around, walking around, let me just tell you, men die more than women when they get infected. I'm not telling you lies. Look at the data. Men are likely to die more than a woman when you get infected. Number two, a Chinese information has come out. We need to authenticate it. But that, even if you survive, you become impotent. Your testicles are frozen. I mean, let me use that word, frozen, are knocked out by the virus. Okay. So it makes you impotent. So men do not come out. Women do not. I like the women. They don't come out. Women are serious. Men do not come. If you must come out, you're a soldier man, policeman, a doctor, electricity corporation worker, you must protect yourself. Please, I'm not joking. The men die more than women. Look at the data. In Ghana, similarly, men die more than women who are infected. Next one, the chronic catarrh person or somebody who recently gets catarrh. What does that mean? At this moment, if you have recent symptoms that are worrisome, coughing, sneezing, please go to the nearest doctor and then seek help. They will take you through an algorithm, and most likely they will test you. Again, if you have cold symptoms, catarrh, sneezing, go to the nearest doctor. Why? We don't know who has it or who hasn't got it. So it's better to seek help. If you sit at home and you don't tell anybody, two things will happen. One, you're going to spread it to your friends and family, your loved ones, and you might survive, but they will die. You'll be left alone. So please go to the nearest hospital. Number two, there are people who have chronic lung problems or allergy. Doesn't mean that you're having COVID. The gentleman who said he has been having catarrh for a year is not likely to be an infectious type. There are two types of catarrh, let me say. One is allergy related. The other one is an infectious process that comes in, gives you body aches, your body becomes basah. If your body is basah, you have fever. Right now, go and see the doctor so that they can test you for COVID-19. Don't hide. If you hide, you'll spread it, you might die, and your family might die. Two, the person who has been having catarrh for a long time, it's likely it's an allergy. So you can take allergy medications. These are over-the-counter medications. So go to the pharmacy and ask them for cetirizine or loratadine. Or just tell the pharmacist you think you have allergy. They'll give you a nasal spray and then loratadine. But if the symptoms just happen within the last few weeks, please don't go to the pharmacist. He will drive you away. Go to the doctor so that he can check you for COVID. Next one, throat pain. People are complaining of throat pain, dryness in throat. There's a lot of anxiety these days. There's a lot of symptoms that we can't imagine. The other day, I was having this body aches, and I said, hey, Dr. Kama, maybe this is the thing. But it is happening because we are anxious. We're not sure. Just be reassured. If you're having symptoms that have been going on for a long time, throat pain, maybe it's acid related, maybe it's allergy. So please don't get alarmed. But if you take the local remedies and it's not helping, go and seek for help. That's my advice. Most likely it's acid related due to the acid reflux. So you can take something like Nugel, or I'm not advertising a drug, but antacids. Just go to a pharmacy, say that you want antacids, Aludrox and things like that. That will help you. I think that has to do with all the questions that were related to the infection.
Okay.
Now, there were other questions that were not directly related, but slightly. Okay. One mother said, should she take her child for weighing? Weighing has other components. We don't want people to go out if they can prevent it. But during weighing, they may have vaccination. So it would be nice you find out from the facility, are they giving the vaccinations? If they're giving the vaccinations, cover the mouth of your child, the nose and mouth, cover yourself, and then take care for the vaccination and come back home quickly. When you get to the hospital, make sure you don't get too crowded. Please don't get crowded. But always find out from the local hospital that are they doing it before you can get out there. And then there's a gentleman who complains of a rash on his penis anytime he has sex. Please, that could be a sexually related infection. There are so many types of rashes. It would be better you wear condom till you get to see a doctor who will make a diagnosis, appropriate diagnosis. There are so many different types. So my advice is, if you can't stay away from the woman, then you have to wear condom. Don't give them whatever you have, please. Next one, a child has a tie, there's a ligament that is holding the tongue down and the child cannot speak. Unfortunately, this can be done within a short period by any doctor who is very comfortable with it. But the doctor told you to stay at home till the COVID is done. I think his advice is prudent. Yesterday we talked about collateral damages. There are people who are staying home, they can't get their surgery, their elective surgery, we had to wait. Sometimes the tongue can get untied, let me say that by itself. But if it's not, the doctor has to do the operation. It's a simple operation, but you call the doctor if you're worried that the child cannot talk. Call the doctor and see, maybe he'll be able to arrange something. He'll be able to arrange something. I think, Mama B, I have summarized most of the worries people had. There were over 30 questions. I believe there are more questions that can come.
Yes.
But let me just emphasize two key portions. One is the stay-at-home directive. And then two is to the healthcare workers. Please, desist from fighting authority. Please, desist from becoming cowboys, going things on your own. Let's come together. We are together in this. This is the beginning. In my view, this is the beginning in Ghana. We don't know where it's going to go. So this is not a time for us to fight and to disrespect authority. If the supervisors are telling us something, we should follow this. Wear your mask. If they are not saying do not wear mask or they don't have mask, create one. My advice since February, I have said this, that all healthcare workers must wear masks, whether the person has symptoms or hasn't got symptoms, for your own protection.
All right. We've got some more questions on the WhatsApp page right now. So let me just read them out, and then we can take, I think we can take some very few calls as well, if that's also possible. This one says, my name is Mustafa. I have some pain in my left side of my chest. What should I do? Pain in the left side of the chest. What should I do? But you didn't say for how long you've had that. Kindly do not call my WhatsApp number. You just prevent me from reading messages that have been sent to the page. This one says, I'm Candy from Nima. I'm feeling body weakness, headaches, and loss of appetite. What should I do? Maybe you can, Doc, maybe you can tackle the two questions. One is...
Yes. Okay, so there was also a question about chest pain that was sent yesterday, but I tried to slide it off.
Okay.
Now that there's another chest pain, I might just combine the two. Chest pain is a very common symptom, especially when it's left-sided. It could mean serious condition, but most of the chest pain in Ghana is not serious. It's either due to muscle ache, indigestion, acid-related. These are not serious. Even though they can be nagging, they're not serious. But anytime you have chest pain, you want to find out, is it heart-related? So we normally do an ECG and then take you through. If the chest pain is new and worsening, you have to go to a hospital immediately. It could be the sign of a heart attack or a serious problem like dissection of your main artery. So chest pain depends on the duration, like we asked him to tell us how long it took. So Mustafa, if your chest pain is new onset, go to the hospital, they will take care of you. They'll look at an ECG and then see what is going on. Make sure there's not a heart attack. If the chest pain has been going on and off, take paracetamol. Just wait. If it's been going on for more than 1 year, don't even bother. Don't go anywhere. Stay at home, take paracetamol, let your wife or better half massage, put some warm towel over the place, it will get better. But if it is new and getting worse, when you walk or shortness of breath, then you have to seek help. Bodily aches in Nima, Kanda, that area, Dansuma, where is the other place that the people ran away initially and they were found?
I think there was Agbogloshi as well.
Yes, Agbogloshi. Those places, please, if you're having any new symptoms, go to the nearest hospital. Why? It could be nothing, but it could be COVID. And if you're found early, they can take care of you quickly. And two, you will be prevented from spreading it to your loved ones. So it is better. So I'll advise you, please go to the nearest hospital. They are ready for you. They will take you in and check you. Maybe it is nothing. Maybe it's malaria. So, and maybe it is depression. You know, I talked about the problems with having some of these symptoms that are not going away with paracetamol. Just go to the hospital. Even if you don't have fever, let me stress that. Even if you do not have fever, go to the hospital and just say that you live in this neighborhood and Dr. Akama mentioned my name, that you should come and get checked. Maybe it's COVID. Okay, it's better that way.
Alternatively, you can just call 112 and talk to them. This one says, what happens to the patient who is given an appointment to take chest x-ray at cardio department at Korle Bu but lives outside Accra but locked down? What should the person do?
So it is likely that x-ray was not emergent. If it was emergent, the x-ray would have been done immediately. Two, it is likely that that person living outside Accra saw the doctor on a routine basis. So that means that I'm trying to create a scenario where your condition is likely not life-threatening and it's not an emergency, so it is better to stay at home and wait. Similarly, if you are told to do echocardiogram, that's my specialty. Echocardiogram these days, we do it only on emergency basis. I just sent a message to my boss that at Korle Bu, we will not do echocardiogram, we will do it at the bedside. My colleagues have agreed that we will go to the bedside and do a bedside echo if it needs to be done, because we're risking people carrying them, moving them along the hospital corridor, getting them to do echoes. So now, all my team members at Korle Bu, if you need an echo, it must be emergent. If it's emergent, we'll come to the bedside and just look and answer your question for you. So please, if your test is elective, just stay at home till the COVID is over. If you're having symptoms because of your chest symptoms, you can't get a relief from your medications, please go to the doctor.
Okay. All right, let's bring some more messages, more questions. My name is Sadat from Nima. How does the virus react in your body when you have it, but you do not know? This one says, okay, here we go. My waist is paining very seriously. What should I do? So waist pain, somebody's complaining about waist pains. This one says, I have shocks from the left side of my back through the left side of my chest. I'm not sure if you understand the description. Doc, to my head for 6 months now. I've been to the hospital severally and still I feel the same pain. This one says, having heartburn and a pain at my back. That's from Ernest, sending that question as well. Here's another one. Says, anytime I want to urinate, discharges in the form of sperms comes out of my penis before the urine, but it's not sperms. Very thick, but I don't feel any pains in my penis. That's another message that came through. Here's one from Riyadh, says, advise Ghanaians, they seem not to believe the danger. Okay, so thanks for that comment. This one says, no, I think I've done this. Okay, here we go. Doctor, I've been coughing more than years. What medicine should I use? Okay, Emmanuel says, I'm having dry throats for a month now. Maybe I should stop then so you can tackle the questions.
Okay, so thank you very much. Let me tackle the virus in the body. So what happens? Assuming somebody coughs into your face or you inadvertently touch a surface, the micro droplets. When it gets into your nose, it gets into the cells. The virus needs to get into your body. Once it gets into your nose, it gets into the cells, and then it begins to give birth, literally. It will replicate into several fold. Then it goes directly into the lungs, because the lungs gives it a chance to move into the cells, because the lungs have some special cells that have a door that the virus needs to enter into the cell. So the lungs are the most often the first place where it can grow quickly. So when it gets into the cell, assuming one gets into a cell, by the end of the day, so many will be coming out. Twins, identical twins. And then each of them will quickly get another cell. They don't stay, they have to get another cell. And then, so are you seeing the mathematics? It's called exponential growth.
Okay.
By the time you realize, it's all over your body. But the annoying thing and very scary aspect about this virus is that it won't tell you anything, but you start giving it out. You start giving it out. And by the time you start having the symptoms, you have given it to so many people. That's why you have to wear the mask always. Then when it gets into the lung and now you're having symptoms, it begins to destroy the lung, allow water to flood in, allow other bacteria to infect it, and it drowns you. Then it affects your heart. The heart becomes really seriously affected. It becomes weak and has this rhythm problems, and the person might die. It affects the kidneys, it affects the brain, it affects the liver. So this virus is dangerous. It's very, very dangerous. Now, it so happened that 80% of people might have a mild form and they will get over it. But unfortunately, 20% will have a bad to worse form, and few will be critically ill, and they might die. Who are the people who are likely to be suffering from the severe form? People who are older, people who have medical conditions like diabetes, hypertension, heart condition, heart failure, heart attack. Please stay at home if you have all of these conditions.
Okay.
The reason is, if you do not and you get the infection, your chance of survival is abysmal, especially in our environment. For the chest pain, let me lump the pains together. These are chronic pains, they're severe waist pain. Please lie on a hard surface, maybe the ground, on your back for about an hour, see it to relax. Most likely it is a muscle spasm, maybe it is a prolapse disc. Maybe you bent to pick something and you caused a prolapse disc. Take pain medicines. I will advise you to get diclofenac or any of the stronger pain medications and paracetamol combined, and then heat therapy. Put a warm towel around your back and then try to lie on your back flat. Hopefully the muscle spasm will get better. Okay. If it doesn't, you have to go to a doctor and then they'll take care of it. 6 months of pain, chest pain, likely to be not related to the heart, but we can't tell. So maybe you need to take pain medicine till this COVID is over, then we can assist you.
Okay.
The heartburn patient, please use antacids. Go get antacids. Wear mask when you're leaving the house. And then when you come back, take the antacids and see whether that will help. The person who urinates with thick stuff coming out before the urine. Sometimes it is sperms. You might not know that it's sperm, but it could be also an infection. So I would say now that it's been going on for a long time, don't rush, don't get too anxious. Wait till the infection is over, the government releases eggs to come out, and then you can go and see the doctor.
Okay.
Young people especially can sometimes have sperms coming out in their urine, young men, because they are so productive at that age. But this gentleman, is difficult to know whether it's an infection or it's not infection. But it's better to wait. Drink a lot of water to flush your urine, and then if you're going to have sex, use condom till you see the doctor.
Okay.
I think we've answered most of these questions.
Yes, you have. Let me ask you another one. This one says, I have a friend who is scheduled to visit a doctor in Kolibo. His medicine, and he gives the name hydrogen chloride, is finished and cannot get some to buy. He's very scared and tells me he has started experiencing pains in his body. Ask the doctor for me, what should he do?
The medication is not pronounced well or it's not written well.
Hydrogen chloride?
Is it
nothing like that?
Hydroxychloroquine or hydroxychloride?
No, just hydrogen chloride. That's what was written.
It's difficult to know because it's possible if it's hydrogen chloroquine, which a lot of people are buying and stocking, please return them to the pharmacist. If you bought hydroxychloroquine or chloroquine, please send them back and collect your money. The reason is we need this medication for special people with chronic, debilitating, very severe pains in their joints. These are people with SLE. I don't know if you know about that, but look it up, SLE. I don't have time to go into the details, but if the person has SLE, there is a line they can call. Please, Mama V, can you put up the Kolibo lines I gave you?
Okay,
then they can call, and then we'll try and fill it over the phone. Okay, so please don't get too distressed, and don't wait till the medicines are over. A week before, start making arrangements to get your medication. And then take it to the pharmacy. And I told you the pharmacists have been the best ever. I applaud them. They refill the medications. If they are critical medications, they call to get approval. But they will fill the medications for people. Don't wait till the last minute.
All right, so I'll share the number before we wrap up our show. Here's another question. It says, I've been experiencing dizziness and weakness anytime I wake up in the morning. What should I do? So
this has been going on for how long? I don't know. But
they didn't say.
Yes, it could be part of the sitting at home syndrome and feeling bored syndrome and really don't know what to do syndrome and getting worried about COVID syndrome and looking at WhatsApp too long syndrome. I told you guys, quarantine your WhatsApp. Quarantine it for 24 hours, 48 hours, and see the relief. You'll be so amazed. The relief that will come to you, the peace. Don't listen to news that are bad about COVID. Just relax. Call your people. Call people by video. Okay? Turn off if you want, just delete the WhatsApp. And then you can do your phone calls on the internet till you reinstall it 48 hours later. So the other thing is that if you're having these symptoms recently and you are in Ghana, it will be good to go get checked because, again, it could be COVID related or it could be malaria, it could be nothing. But if you're sure you haven't contacted anybody, take some medication, paracetamol, relax, drink a lot of fluid, do some exercises, get some fresh air, go out in the yard, get sunshine, and lighten yourself up.
I kind of feel that there are a lot of messages still coming through, but related to bodily pains. Somebody says, I have a sharp pain, all those things. And I feel like what you've just said, the fact that people have been home for such a long time, or they've been restricted in doing what they would normally would do so that they don't feel what they're feeling. So I guess that kind of wraps up. Maybe you should wrap up with the general, what we should do to be active, so that we don't get bored in ending this this consultation session with you.
Okay. Well, I want to thank Multimedia Joy TV News for giving the opportunity. And also, let me just remind people that this is unprecedented. We've never had this. We have never experienced this. We don't know the treatment. We do not know the treatment. Everything is experimental right now. So most of the treatment we give is supportive and prayers. Supportive and prayers. Alleviate all the pain, the worries, the anxiety. Please seek for help. Don't sit at home if you have any symptoms and hide it. There's been stigmatization, which is wrong. We shouldn't be stigmatizing this. We should be welcoming them with covered nose, obviously, and turn them to the hospital. Support them. They are going through mental turmoil. The anxiety, the thinking of just having this virus is causing a lot of panic and despair. So please, I would advise that stay calm, stay at home, do not listen to bad news a lot. Try to stay off in social media and all the gossip, and then be prayerful, drink a lot of fluids, do a lot of energy walking around, at least 30 minutes a day, and then follow the instructions from the government. Listen to the government. Healthcare workers, let's give solidarity to the poor workers who have been infected in the line of duty. I'm wearing this red here in solidarity. I respect them, and we are going to go all out to make sure that people are well taken care of. I wrote a piece about the fact that we should all be frontline. We should all be frontline. And this clearly tells us that we are all frontline. Healthcare workers, soldiers, policemen, you're doing a good job. And I credit the Electricity Corporation, GRICO, all of them. I take care of some GRICO patients, workers, and they are all wonderful. They're all helping us stay with this terrible problem. And the media, you guys are really awesome. But I wanted to do more investigative journalism and then report the stuff the way it should be done. That's my advice.
All right.
To sum it out, please stay at home.
Okay.
And take care of yourself.
All right. Doc, thank you very much for these words. Yesterday, you shared a WhatsApp number that people could get in touch with you. I got a call, somebody wanted it. Is it a number that you still want to give out?
I've devoted this period to it.
Okay.
My wife says I don't have a life. I don't have a life. So I'm going to devote it. Those questions that I cannot answer, I'll forward it to my colleagues, my senior colleagues, those who are specialized. They'll help answer. And because of the crowd, because of the number of people calling in, please don't call. Send me a WhatsApp. I'll try and answer.
Okay.
If you call, then I don't have time. I have to work. I'm going to Korle Bu right now. And so you are going to distract me from my work. But I'll try and answer as much as possible. Don't send me emergency information. These are mild information, cautions. But if it's emergency, please go to, if it's severe symptoms, go to the nearest doctor.
Okay. All right. Okay, Doctor.
Or call 112.
112. All right, Doc, thank you very much for your time again this morning. I have the Korle Bu numbers to share before we wrap up the show, but Dr. Akama, we're grateful for your time. He's head cardiology department, Korle Bu Teaching Hospital. He's been our consultant this morning. Ask the AM doctor. That's what we've been doing. We have another set of conversations to bring you. We're looking at the arts industry. Everything is so quiet these days. What's Uncle Ebo White up to? We're going to be checking up on him. We'll have conversations related to the creative arts industry up next here on our show.